So, how many of you have heard of chromosomes? Parmade? Some of you have heard. How many of you have heard of genes? John? How many of you have heard of genes? How many of you have heard of DNA? Okay. Okay. So, a lot of you have heard of DNA. So, that's what I'm going to talk to you today about. Us, our DNA, what it can tell us. Okay? So, I was a student like you all, long time ago, 25 years ago. That looks a very long time when I said 25 years ago. It's actually more longer than that. I was an A-level student 27 years ago. So that's long time ago. So, and I was wondering what do I want to study, and I thought, okay, I will do medicine. So I went to medical school and became a doctor, but I wasn't happy being a doctor. I thought, okay, I have to do something that I like now. And I wanted to do genetics. So in 1992, when I was in the medical school, I went to meet with the professor of genetics. And I said, I want to be a genetic doctor. He said, are you mad? Why? Because genetics was not developed. So he said, okay, are you mad? I do want to be a geneticist. So are you mad? Then I went and told my friends, I want to be a genetic doctor. And he said, they said, are you mad? You want to be a genetic doctor? Nobody knows that. It's rare disorders. But I will tell you today, genetics is not rare. All of you will one day be carrying your genetic profile, entire genetic profile. And we'll see a little bit of my profile today, later on. But I want to, why do you become a doctor? These days, a lot of people become doctors to make money. Okay, that's good. You become doctor to cure people. Okay. So, I have a daughter who is like, she's in grade 5. When she was in grade 2, she asked me, what are you doing? And I said, I'm a doctor doing genetics. And then she asked me, she somehow had found out that genetics is something permanent, you can't change. Then she asked me, how do you treat patients? And I said, I don't treat patients, I talk to them and cure them by talking. And that's what we were able to do in the past. We could only, talk to the families, tell them what is going on, listen to their sorrows and talk. So if you talk well to them, they will be happy, and at the end of it, that's all that you could do. But today, you can go beyond that, actually, and treat and help patients, and that is a very exciting thing. So let me talk about a patient with a genetic condition that we cured. Have you seen these type of pictures? What do you think this is? A child going to space? No, it is not a child going to space. It is a child who can't live in the normal world. What do you think? Why do you think you will not be able to live in the normal world? What will attack you if you go out to the normal world? All the infection out there will attack you. I mean, as you wait here, infection is attacking you. All the microbes, bacteria, fungus, viruses, they are all attacking you. But how are you waiting like this? Because you have an immune system. Yeah, that's right. You have an immune system. Immune system is protecting you. ප්‍රතිදේහ වලින් වහගෙන මේ බැක්ටීරියා වලට fungus වලට virus වලට අපිට attack කරන්න වෙන්නේ. If you don't have that protection, then you can't live in a normal world. So these are children like this. They can't live in a normal world because their immune system is not working. So the only way, long time ago, they could live, if they lived long enough, was like this, inside a bubble. Inside a bubble. So they are called bubble babies. So he is a bubble baby from Sri Lanka. I don't know whether you read newspapers. There's a newspaper called the Sunday Times. This child is very famous in Sunday Times. I'll tell you the story. His name is Sanjana. I don't know whether anyone heard. But Sanjana has a problem. His immune system is not working. What are these? This is a cell on this side, and those are chromosomes. How many chromosomes do we have? There are 46. 23 from the mother, 23 from the father. That's how we got it. And those last two chromosomes are the X and the Y chromosomes. Now all the girls here have 2 X chromosomes. All the boys here have X and a Y. So what do we have then? So therefore we are different in that way. If you have X and a Y, you become a man. If you have X and X, you become a woman. But it can be the other way around also. There are certain women who are X and Y. There are certain men who are X and X. That's also possible. Those are rare things. I have seen people like that. But they'll be normal males. So, usually it is X and Y for a man and 2 X's for a female. But there can be other way around. But there can also be super women, They have 3 X's, 4 X's, 5 X's. I have seen them. And of course, there are also women who have 1 X. But there are unfortunately no men who have 1 Y. But there are men who have 2 Ys, 3 Ys. Those are all possible. And in school you study cell division, right? 2 types of cell division. Mitosis and meiosis. So go and think of how can all these variations be created. It's very interesting. There are people out there who we see on a day-to-day basis who have this, but they are the male or female. You have no way of finding out unless you do a test. You can take blood and study chromosomes. We do it in our lab every day. We do thousands of people every year, and we give various reports. So now, what's happening in Sanjana? In him, he has a problem in his X chromosome. And where did he get the X chromosome from? He gets it from his mother. Boys get the X chromosome from the mother. And they get the Y chromosome from the father. Okay? So he has a problem there. So if you unwind that chromosome, what do you have inside that chromosome? A big DNA molecule, which is arranged as a gene. And in the gene, what do you get? These 9 nucleotide bases. A, B, C, D, all those are there. What will be there in the gene? So, what's happened is that there is a change in one of these bases. I'll show you that in a little while what he has. But he has a change in this base. So now what's happening? So if you look at this family, that is Sanjana's father. On the other side, that is Sanjana's mother. Then you have, when they have children, there are 4 possibilities. If you look at the chromosomes, the X and the Y chromosomes of the father and the mother, you can see In the father, there is a normal X chromosome and a normal Y chromosome. In his mother, she has a normal X chromosome, but also abnormal X chromosome, where there is a genetic mutation. But why is she not affected? The normal one is protecting the abnormal. So that is why she is not getting the illness. So if the father sends the normal, if the father sends the Y chromosome, normal boy. If the father sends the normal X chromosome and the mother sends the normal X chromosome, then you get a normal girl. If the mother sends the abnormal one and the father sends the normal one, the X, then you get a daughter like the mother. But if the father sends the Y and the mother sends the abnormal one, then there is no way to protect. And you get a son who has a illness. So this is what's happening in that family. Now, this is what their family tree looks like. Now, we as doctors draw family trees. When we draw family trees, we draw squares to we do squares like that to show males. We draw circles like this to show the females. So we have males and females. So you can see these are 3 generations. The very oldest one, there are so many boys and girls. Then that generation, then there were grandchildren, then great grandchildren, and now this generation. So this is Sanjana's mother and father. They had 2 children before. Both of them were male before Sanjana, and both of them died. And as you can see in that family, there are all these black boxes of children who died, and all the children who died generally are males. And those all black boxes, there are, I think, 1, 2, 3, 4, 5, 6 there, and then 7, 8, 9, 10, 11, 12, 13, 14, 15. 15 of them died. They all died when they were about 3 or 4 months old. So that was the sad story of that family. And now here is the mother and father who want to have a normal child. So they actually came to me after the second child was dead. After the second child died, this time. And they came and said, this is our family history. What can we do? They were very unhappy and sad and so on. So I told them, okay, why don't you get over this grief and come, we'll help you have normal children. But they didn't come back for a long time. And then they came back like this, bringing Sanjana inside the womb. So the mother was pregnant again, and she wanted to know, she has a baby now, and she wanted to know, is this baby going to be normal or no? So how do you do that? How do I tell that? How do I tell that the baby is normal or abnormal? So you know this, right? So what do you know from this? If it is a girl, it will be normal. If it is a boy, that's 50% chance the boy would be affected. So I tossed the first coin, as it were, boy or girl. I lost the coin, I tossed the toss, because it turned out to be a girl. That was a boy. How do you find out whether it's a boy or a girl? What can you do? Well, inside the mother's womb, how do you do it? You can scan. You can scan and, okay, I told my friend, the obstetrician, scan and tell me, and he scanned and said, Vajira, I have bad news for you. It's a boy. So usually when it's a boy, it's a good news, right? That's what a lot of parents. So I said, bad news, a boy. Okay. Sorry girls, I'm not You know, I'm not going to tell that. Sure. Okay. Okay. Right. Then here, around the baby, what do you call it? Amniotic fluid. You can take the pot out, or you can go in through. What is this? It's umbilical cord, right? So all of us were connected to our mother with the umbilical cord. You can take blood from there. So I will do that. So my friend, the obstetrician, he got water from around the baby. And we did a genetic test. And this is what we found in him. So he had that bad green peak. He has only one peak. Why? He only has that bad gene from the mother. He doesn't have a normal gene from the father. So therefore, we know he's affected. So, what do we do next? Well, in most places, they will say, take the baby out and kill the baby, right? Abort the baby. So what we didn't do that. We said, okay, let's cure the baby. We can cure the baby. So how do we cure the baby? Where is our antibodies, immune system located? It is in the blood, right? Where is blood produced? In the bone marrow. So what can you do? So let's go from there. So in the past, basically, unless we do this, there's no way. But now we can do it. What do you do? You can actually take a person. So we can take Sanjana, give him some drugs, and give him radiation, so that all his bone marrow dies. So he has no bone marrow. And then you can get bone marrow from a person who matches Sanjana, genetically matches Sanjana, and put that bone marrow into Sanjana. And then the new bone marrow will go and get your marrow and give it to the liver. So you can do this. And we do it. When Sanjana was born, we didn't do it in Sri Lanka, but I'll tell you about it a little while later. We are doing it now in Sri Lanka. Yes. But so to cure Sanjana, this is what we have to do. Take his marrow out, put bone marrow in, and let it grow. So that is what we did. But we had to, because when he was born about 5 years ago, 4 years ago, we couldn't do it in Sri Lanka. We had to send him abroad and do it with our friends. But it was very expensive. So we had to go to the press and say, okay, give us money to cure him. And a lot of people gave a lot of money. How much do you think it cost actually for us to cure him? Anybody for 1 million rupees? That's 2 million rupees. 3 million rupees? No. 5 million rupees? No. 10 million rupees? Nobody? 50 million rupees? No, he actually cost about, it cost about 10 million rupees. Okay. For him, he actually needed 2 transplants. So, because first one didn't work, so we give him a second one. So he actually ended up costing about 14 million rupees. Yeah, it was so expensive. Why? It was because it's expensive because it's done abroad, but we can do it for half the price in Sri Lanka. So we are doing it. So anyway, he's cured. He's not in a bubble. That's his mother. Yeah, fine and okay. That is what he was last year. 3 years old. And this year, in about 1 week's time, he'll be 4 years old. He's not in a bubble anymore. He was never in a bubble to begin with. And we don't need these kids to be in bubbles. So this is what we can do. So you can see, you go back to his family tree. 15 kids dead before him. And he's the survivor. So you can see the, the satisfaction in the entire family. We have got out of this thing which was going on for, you can believe, like about 50, 60 years in that family. Boys were dying, except these boys who actually were not related through a woman, it was related through a male person. So this is what modern science, genetics, modern science, personalized medicine can do. So to do that, you can actually go get DNA, analyze DNA, and cure. So there are lots of children out there, lots of families out there where there is no cure for some of the conditions that they have. And they go from one doctor to another, or they are very unhappy with the doctors. This family will never come to doctors because they can't cure this. But using modern technology, we can actually cure it. So today, more and more cures are coming for conditions like this. Now this condition is a rare condition. What do you mean by a rare condition? What do you mean by a rare condition? How frequently? So how many people in this world will have one of these conditions?
About 1 in 1 lakh.
Yeah, 1 in about 200,000. So 1 in 2 lakhs. 1 person in 2 lakhs. But rare conditions are not rare because 1 in 10 of us. So we have about 50 people in this audience today. So 5 of you will have a rare condition. I have a rare condition. Can you see? So my mother knew about it before I was born, long time ago. So how did she know about it? I was born in the 1960s. I won't tell you my exact age. So my mother knew about it those days. How did she? Ultrasound scan? No, not ultrasound scan. Ultrasound scan was not invented. The astrologer told her, your son will be born with one eye closed. Right? So that's, my mother knew that. Like this. The so-called DNA analyzers, which enable us to look at our entire genome. Not just one gene. So if you come to my lab next week, we are getting one of these. And the week after, we should be able to get a blood sample from you, study all your genes, and tell you what variations we have. So I was very curious about what is going on in me. And a few years ago, I was able to get some research funding, research money, and send my sample to a lab abroad and say, okay, do all my genes and tell me what do I have. So I know quite a bit about myself. And I will tell you about what I know, because this will happen to you one day, because you can use it and know it. So I have, in my genome, how many nucleotides do you have in your genome? A, T, C, Gs, how many do you have? Do you know the entire number? 3 billion. Right? 3 billion. So out of the 3 billion, about 1% differs in people. So in my genome also, there's 1%, about 3 million. There are changes. There are various other details of it. I'm not going to tell you that. Also, I have 3 million changes. And that is what all of us are. Like if I were to sequence all your genes and compare, how similar are you to each other? How similar are you to each other? Let's take one girl from this side and a boy from this side. How similar are both of you genetically? 99.9%. 99.9% you are similar. If I bring in, well, there's no French person here in the audience. Is there a French person? There is? Okay. Okay. Yeah, it is. So how similar is he to us? yeah, he's 99.9% similar to us. You know. So if I bring in an African, how similar is that person to us? It's 99.9% similar to us. So that is why we are all human. Okay. So anyway, so but that 0.1% equals 3 million differences. So we have 3 million differences. All right. You know, I have a bioinformatician in my lab, and I told him, okay, look at all my variations and tell me how many of those are bad. This is what he said. He said, I have all these, you know, 800 of bad ones. And I said, okay, look at it more and tell me what is really, really bad. And he gave me quite a bit of information, and I'm okay, but I'll tell you a few things that I wanted to know about. Now, I have a condition called glaucoma. How do I know that? Have you ever heard of what glaucoma is? No? It's a vision problem, right? So one day I can go blind. How do I know that? Because my grandmother, my great-grandmother went blind, and then therefore people knew about it. So this is what happens, like you develop pressure in your eye, and inside your eye there's a cup that turns like that. So when the doctors look at my eye now, it looks like that. But you can control it now with medicine, so I won't go blind. I won't go blind, so I know that it's only if I neglect it. But I was curious to find out, do I actually have a mutation which is causing this? And the answer to that is yes, I have a mutation in one of the genes which is causing this. So I know what is happening, why have I got that. So one day, if the scientists find a way to correct that change, then I will have a cure. And the way science is moving, that is possible. That will happen. I have a very common skin condition. I'm sure a lot of people here have. It's called ichthyosis. What's that? Dry skin. Right? So you know, legs look like that, a little scaly. This is extreme. So that is ichthyosis. So I asked my bioinformatics person, do I have a mutation for that? And yeah, you turn around and say, yes, you have a mutation which is causing common ichthyosis. So what are the other types of thalassemia you have? Yes, beta thalassemia, and what's the other type of thalassemia? Anyway, alpha thalassemia. Right. So when you do this test, because you are looking at all the genes, I also know that I don't have alpha thalassemia because the alpha thalassemia gene was also tested. So that is right. You know, our family, we go to astrologists, so they say a lot of things. So my astrologist says, I will develop diabetes. And one day, I will be, checking my blood all the time. Okay. So I asked my bioinformatician, do I have genetic changes which will make me develop diabetes? So the answer was unfortunately yes. So that means I have to cut down on all the sweets that I eat and so on. But anyway, at least I know that I have an underlying predisposition. So I can do something about it. Okay, so you can control your bad habits. So that is the beauty of it. So what are other bad habits that people have? Smoking? Yeah, a lot of people smoke. I have never smoked. But my father was a person who smoked about 40 cigarettes per day. So he burned a lot of money. So, but I now forgive him because my bioinformatician tells me that in my genome there is a genetic change which predisposes to addiction to smoking. So I'm really happy that I never took this, even tried it, because if I had tried it, I would have probably become addicted to smoking. So I don't eat it. So thankfully, I'm fine. So like this, you can begin to understand. So you can see now, unlike in the past, by looking at your genome, you can begin to understand who you are, what disease you have, what kind of predispositions you have, and take control of your health. Because after all, you don't want to fall ill. So you can see by looking at my genome that there are certain conditions that I have, nothing serious, though everything is not so serious, but there's a genetic basis for that. Then there are certain things for which I'm predisposed, like diabetes. So if I don't do something about it, if I don't exercise, I don't cut down on my sugar and things like that, then I'm basically not being responsible about my life. There's no point going to doctors after eating all the junk food, Coca-Cola, burgers and everything, and saying I have now got diabetes, if you really did not take care of yourself. So that is what genomic medicine is all about. Another thing that genomic medicine is telling us is, okay, based on the our genetic profile, we can tell what medicines will work for us and what medicine will not work for us. Now, how is that? If you take a drug, if you take any medicine, that medicine is like eating a food, right? Am I correct? Same thing, like, although it's in a pill, we just put it in our mouth, so we ate something. What happens when you eat something? It gets absorbed. And where does it go first? It goes to the liver. In the liver, what happens? It gets converted to other things. So the enzymes in the liver can convert this and make them inactive. So if you have enzymes in your liver, certain because of genetic mutations, if you have altered enzymes, what can happen? Two things can happen. One is you may have enzymes which will destroy the drug. So even if you take the drug, you won't get cured. The other possibility is you may have enzymes which are inactivated. So when you take drug, there's no way for the body to inactivate the drug. So what happens? It becomes an overdose. And then you get other illnesses as a result. So I asked my bioinformaticians, what do I have that type of thing? So they looked at it and said, yes, I have genetic changes which make certain type of drugs which you will take if you have infections with viruses. Those drugs will be ineffective. If I take them, it will not work. Because I have a mutation which will destroy them. Then there are certain drugs you give for high blood pressure. So I have a mutation which will destroy those drugs as well. So therefore, if I have high blood pressure and I take that particular drug, it will not work for me. So now I'm beginning to understand more. So with this information, although I'm a doctor, if I also feel, if I fall ill, I'm not going to treat myself, I'm going to go to another doctor. Right? So the one rule of doctors is, you don't treat yourself. If you're treating yourself, you're a fool. Because you think this is the best thing for you, and you will kill yourself. So you always go to another doctor. So that's what I do. So, but if I were to go to a doctor in the future, I will tell you, these are my mutations for the drugs. Therefore, please, if you're prescribing, prescribe something else. So I have 63 of those mutations. And there are about 60 drugs which will not work for me or will become toxic. So I have shown you then a different perspective altogether. Now we have our genome in our hands. And actually, this is a smartphone that I use. I can carry all my genetic information in the smartphone. And all of these things that I am telling you now, there are apps. You can get your DNA sequence, put it into the app, and with the app, you can find out all of these things. So correcting the genes, gene therapy. Who is the first child in the world or first person in the world to be treated for gene therapy? Well, it was a Sri Lankan child living in America who was treated in 1991. Surname is Dissanayake, I keep on forgetting her first name. She had a condition like Sanjana, where her immune system was not working, and she was the first person in the world to receive gene therapy. She unfortunately died last year, I think after living for about 20 odd years. She died. But she lived a normal life. So unlike in the past, rather than saying genetic change, abort, now you have a situation of genetic change, let's treat. And as you can see, when you really dig into the genes of all of us, all of us would have more than one genetic change that is causing our illnesses. That's what I was trying to illustrate with my genome. So I'm a healthy person, but I have these different things which I can explain with my genes. So similarly, if we were to do the same thing in all of you, all the information that you know about yourself will become more meaningful. And that is what we will be doing in the future, and we'll be using in the future. So how much does it cost to do this? Today, how much does it cost to actually look at all your genes? There are machines available where you can do it for about 150,000 rupees. So that's 1.5 lakhs. It's not a lot of money, right? You will find out in the past, in the future, it's not a lot of money, 150,000 rupees. But the future is that this will become even cheaper. 10 years ago, how much do you think it cost to do an entire genome? You will be amazed if I tell you the price. It cost about 400 billion rupees 10 years ago. But now today, just 1.5 lakhs. So you can see another 10 years. What is the prediction? Free service offered by Google. Right? That is the prediction. Because why do you want it? Why? The value, the technology is becoming more efficient. So the value is not in actually sequencing, but in interpreting and using that technology. So interpreting and using. So the message is, in the future, there will be a lot of jobs for those who know how to interpret genomes. So, if you are planning to take on a career in science, think of a career where you will be doing that. Either a genetic doctor or who interprets genomes. I was referring to it all the time when I said I was going to buy bioinformatician. So bioinformatician is someone who understands the science as well as informatics, who can analyze the genomes. So that is a definite, exploding job of the future, bioinformaticians. So if you have good science skills, good computing skills, try and merge them. And think of, obviously everybody would like to be a doctor, but develop the skills, the other skills as well, so you can, interpret genomes. And today, the biggest problem that we have is a lot of doctors can't interpret this data and tell their patients what it is. So we are finding it very difficult to, use this information with the doctors. Nowhere in the world, even in advanced countries like America, you can't. Doctors don't know genetics because they passed out long time ago. They're old doctors, old people, and they didn't understand genetics, or they didn't teach genetics in medical school today. So now everybody has to get new training, as it were. So this is my message. So the future is going to be in your hands, your future, in terms of what illnesses you have, what illnesses you will develop. So it's all about health, maintaining a healthy life. And that will become easy because you have your genome in your hand, and you will be able to tell what are the illnesses you are going to have, what are the illnesses you are predisposed to, and if you have a particular illness, why are you having it, what is it in which case it is causing it. And of course, if you are going to the doctor and asking for treatment, you will be able to tell the doctor, well, these are the drugs which don't work for me, therefore don't give them to me. And the doctor will be able to look at it and give you a drug that will work for you and cure you. The reason for that is, the final message is that there are a lot of drugs which don't cure us, and that is why there are common illnesses going around in the world. And that's why a lot of this diabetes, hypertension and so on is very, very prevalent in the world.